Good afternoon, everyone. I see there's a lot of people here, about 228 right now. This is Sandy Reese. I want to just move as quickly as possible. We got a summary of all the questions Ian sent us a summary of questions that were in the last week's post from Friday, as well as some other questions that he had. And so we'll just jump right into those. We have asked Don Shearer from DHCF to join us. He's not muted right now, so we tried to organize all of our payment-related questions up front so that Don can respond to those first. So if we could just jump right in.
Okay. When looking at interactive fee schedule on web portal, none of these modifiers are showing up. When can providers start billing these codes?
Well, those modifiers should be there now. They were loaded on Friday. They were not loaded at the time that the transmittal had been published, but they're there now.
Okay. Many billing codes, when voided, cannot be billed with the new procedure code until the void processes through over the weekend. Do these modifiers work that way, or will they be able to be voided and billed in the same week? If providers must void and have the money pulled before they can rebill, it will cause serious financial hardship.
So you guys will be getting updated guidance from DDS, if not today, sometime later this week, that says instead of voiding the claim should be adjusted. And by doing the adjustment, what you will do is you will add the modifier to the quote unquote new claim, and also remember to update the amount billed so that the letter of logic does not prevent you from getting the additional payment that's due to you based on this change in rate.
In the transmittal for Appendix K reimbursement, under staffing agency section, it says below are rates and associated procedure codes and modifiers, but there are no procedure codes, just $14.65 at 50%. What procedure codes and modifiers will be used for this, or will the invoice be submitted through the HCA?
So the
DDS?
Yes, that's a process where the invoice would be entered through to DDA. And so what we're expecting is, according to the transmittal, that we get the staffing ratio for the specific placement, we get the hours that your employees worked who were regularly scheduled, and we get the invoice from the staffing agency. And all we're really doing there is making sure we know how many staff were needed, how many you worked, how many worked for you and were paid, and the need for the use of a staffing agency. And then that will be verified and then submitted to DHCF for payment.
For the day programs, can the retainer payments be billed under the existing PA, or do providers need a new PA?
So the retainer payments have first we have to identify people who were in the day habilitation setting, and we're working out now how we're going to do that in terms of ensuring that people who were authorized pre-COVID now are going to be able to be billed for with the for retainer payment. And we do have a modifier for that retainer payment. I'm sorry, there's no need for a prior authorization. Those services are already authorized.
Providers need to bill for the services that they have already provided since the start of the pandemic. They are ready to send the time cards for the overtime. What is the specific turnaround time for approval to bill?
Our expectation is that it will take us no longer than 10 days from submission and receipt, before we can actually get that out to you, to DHCF, and then they will then remit the payment to you.
There are potential cash flow implications surrounding the retroactive billing for the past 45 days for enhanced daily rates. This is a concern because the prior claims must be voided, the funds are taken back from the provider must wait 1 week before billing with the new modifier, followed by an additional delay in receiving payment. As such, there will be a 3 to 4 week delay.
That question was just answered where you won't have to void the claim, you'll just have to adjust the claim.
Okay. If the Appendix K retainer rate structure is based on the authorization hours for individuals that would have been at a day program if not for COVID-19, it does not appear that service coordination has an understanding of the Appendix K and the retainer payment provision. How is DDS assuring that service coordinators and waiver staff are correctly determining the authorized hours and dating the waivers?
So, since we did not have a process prior to this, is an interesting question. But what will happen is everyone who's already been authorized, those hours will be used to determine the rate of the retainer payment. And whoever asked this question, you're absolutely right. None of us knew up until a few days ago that we would be following this process.
Per Director Reese's letter on April 30th, letter to Councilmember Nadeau, the district's Appendix K to its home and community-based services for individuals with IDD waiver includes day employment providers that are operated by residential programs as well as standalone day programs in its retainer rate. However, per the Woodland Winslow transmittal, are residential providers that also operate day programs eligible for retainer payments since they have operational costs just as standalone day programs have?
Can I want to respond to this in terms of providing an update about where things are in this regard. So I don't think, well, there's no inconsistency between the transmittal and the letter that we sent, which is that what the transmittal says is for residential providers who are currently providing a service to a person to whom they were providing day services, so that, for example, if someone went from the day program to companion, that in that instance, that person, they could not get the retainer rate for. Keeping in mind that the retainer rate is billed per person for whom the provider provided day services. So residential providers are not excluded from that. What we recognize from what people have presented is that there is a concern. What remained in the retainer payments was everything in the payment except the payment to the direct service staff involved, because there was no payment going to them during this period. By excluding the residential providers, we recognize that some of that retainer cost is not being paid to them, and it could affect their ability to retain that day service to be available once this ends. And so there are a couple of areas where people have raised these issues, and we'll be sending over today to DHCF and discussing with them a couple of areas that have been raised where we expect to seek a modification of the Appendix K. And just for clarification, those areas are this issue regarding retainer payments to ensure that all day service providers get an adequate retainer payment to cover that would cover the portion of the payment related to their program support and indirect costs. The issue of, which we didn't address initially, you'll notice that there were some adjustments in our daily rate just our regular daily rate, which, consistent with the Appendix K, said that we're adjusting the rate to account for the need for increased overtime. But what it results in is an effective increase across the board in all services in their daily rates. What that left out was, I believe, 6 services for which we had hourly rates, where the first 40 hours had no adjustment in the rate, and we're exploring the possibility of enhancing those rates consistent with the enhancement to the what's called the enhanced overtime rate. And that's for those 6 hourly services. I think it's just those things. Let me just.
Yeah.
I'm sorry. And then one last significant thing is, in my response to people, when they raised concerns about the companion rate, I said, you know, if you compare the companion group to like a supported living rate, and are providing it for 3 people, that they are quite comparable. But I recognize that there is a difficulty there in circumstances where you don't have groups of 3. And so what we're looking at is the possibility of enhancing, of creating possibly a companion 2 rate, as well as enhancing the companion 1, so that those are in line with the hourly rate that would be paid for anyone else providing like supported living periodic. So those are the 3 things that we'll be discussing with the HCF, where there have been concerns raised, and we recognize and agree that those concerns need to be addressed.
If a beneficiary can participate in services for a portion of the day, those hours can be billed, and that leaves the differential as the retainer. This does not require a change in the service authorization as an amended goal, as some service coordinators have insisted. It would be an ISP modification only, correct?
So based on the previous answers, we will not be modifying the ISP, which would generate the need for a service author and PA. We're not modifying the ISPs in those cases.
And there's a question here that relates to what I just said. So while it's still down near the bottom, I'd just like to get to it, which was, are the enhanced per diem rate with CR modifiers for all claims regardless of COVID affected? Yes, is the answer. So those per diem rates for all services are for all services. So what you would do, which they'll be sending out the instructions, is for everything that's been billed for all the services on that attached list back to March 11th, is submit an adjustment to adjust for that increased rate for all of those. Because the idea is that that increase will cover the related increased costs of having to provide overtime.
As a speech pathologist, my question is whether we can continue seeing our persons, if not in person, virtually, more specifically to perform mealtime observations and perform staff training.
I had an opportunity to speak to one speech pathologist yesterday regarding this issue, and as I've stated before, these are individual decisions based on whether the service can be provided to the person safely and that the person accepts the service remotely, their guardians are in agreement with the service provider remotely, that the technology exists for the person to receive the service remotely. It's not a yes or no question. Each of these decisions to receive and provide remote supports are individual in nature.
And this is in regards to quarantine procedure. The transmittal refers to prior notification to QRS and prior approval to DHCF. How do providers do that for the period of March 11th through April 30th?
So there is no prior approval process. It is a notification to the quality resource specialist who will not be approving the decision to quarantine, but yet being made aware so that the support for a quarantine home with regard to other services from health and wellness and others can be provided. And with regard to notification to DHCF, the actual use of the appropriate billing code and modifier will be the notification.
Is DDS providing a template for billing for the enhanced rate in res and supported living, or is it just a statement that X number of houses have exposures in the total hours worked in those houses by all staff?
So we have a basic template, but it's not all houses.
So I'm just concerned that this question, is it about overtime or is it the straightforward, a home has been quarantined, a person has been quarantined? And what's challenging about this in some regard is, you know, the facts of the current public health emergency are moving and changing more quickly than things that we're able to send out to people. The idea that a person who had a contact with someone would then be self-quarantined at home for 14 days was very common just 3 weeks ago. Since the mayor issued the stay-at-home, maybe 4 weeks ago, but since the mayor issued the stay-at-home order, it feels like we're all quarantined. But if you read the Appendix K, what it refers to is people who've had a contact or where someone has tested positive. So the idea is that for the sort of base quarantine rate, what you have is an enhanced rate that is pretty significantly enhanced in circumstances where the DSPs are working with people who have had a contact and are potentially COVID-19 positive or have been diagnosed as COVID-19 positive. And so in those instances, it is simply a matter of we have to have the documentation that there is the person who's been diagnosed or that there has been the contact. There's no and those then get submitted directly to DHCF for payment. The only thing regarding quarantine that gets submitted to DDS for payment is when there's overtime. And the reason for that is because if you paid 2 people in a daily rate overtime, what you'll see is the rate that we pay is $13.67 per hour, because what that includes is just the $11 per hour of the overtime payment to the staff person plus the benefits factor. And so the regular pay for all hours worked during that quarantine period is paid directly through DHCF. The overtime pay, just the additional, that would be submitted to DDS so that we can have all the documentation here, confirm that, and then submit just for the additional payment. Now, in terms of the documentation we require, I'm going to defer to Winslow.
So at the point that overtime has been reached by a staff, what we're asking for is the staffing ratio from the home. We're asking for the time that has been paid for staff who worked in the home up to the 40 hours, and then we're seeking the hours of the person who worked overtime. So 4 staff worked, 2 worked overtime. The expectation is you show me all of those people who worked, and then you show me where the others have worked overtime. And when all that adds up, it meets the staffing ratio of the house.
Okay.
For the houses that are shelter in place, providers already know the overtime will be generated as staff are stable and constant in the home. Can providers secure approval for those hours without having to attach the information with every submission?
So again, shelter in place versus quarantine is an issue. If there were an exposure or positive diagnosis, that is a quarantine. So with regard to submissions, there is no submission in that case.
The shelter in place is a circumstance where you submit the documentation to the QRS. And what this calls for is, I appreciate there are some circumstances where it has already occurred. So it says prior to this documentation needs to be submitted to the QRS. Certainly, you know, this is retroactive to March 11th, so there's the understanding that prior to in those cases is going to occur after. But going forward, prior to implementing, that documentation would be submitted to the QRS. If there were concerns that the agency had about implementation, we'd get in touch with you. But the Appendix K and the transmittal don't say prior approval is required. It says prior notice to the QRS is required.
And if I could just add to that, we just ask that it comes in the form of an email or some other written form, just notifying us of what you've done.
Thank you for clarifying that. There's quite a few questions that we received about receiving prior approval from QRS or that QRSs are unaware that they are supposed to approve these requests. So I'm happy we've addressed that. Are providers expected to request approval for the overtime every week before billing?
You don't have to ask for approval for the use of overtime. You just have to show that it was necessary to meet the staffing ratio.
Okay. Did DDS increase wages to DSPs during this public health emergency?
What was adjusted was the overtime factor in the rate that gave an effective increase in the daily rates of about 15%. So it would be up to the providers to use those additional funds to increase the wages if they chose to do so.
All right, this is in regards to rates. The companion rate is $10.48 per hour, given that the living wage is $14.65 per hour. And Andy, I believe you've addressed this with regards to rates that we're looking at.
So the concerns about the companion rate, as I said, we are looking at. As I see it, companion group is adequate. But we are looking at those. Companion group for 1 to 3 works out, and it comes in very close to what the supported living rate is. It's companion when it's provided to 1 or 2 people that ends up being an issue.
Yeah, they asked how will we just tried to bill with the retainer payment codes. We received a message that stated authorization modifier conflict.
Don, you still on the line?
Yeah, your mic's on the line.
I am. If you're billing for the with the addition of the CR modifier, you do not put your prior authorization number on the claim, because your authorization does not contain that modifier combination, so it's going to cause you an issue, and a prior authorization is not required for these services. with the CR modifier.
Okay. If a client is provided services by a DSP for 7 days and the last 2 days the DSP ran into OT, are the providers expected to bill 5 days as regular and 2 days with the OT modifier? The entire process seems overly cumbersome.
So if you're billing at a daily rate, the cost of overtime is included in the rate. You don't bill anything differently. You bill all hours for all of the services listed on the attached are billed according to the modified rate that's included.
Host homes and respite were not addressed. How should those settings be addressed? In regards to,
Not clear. Maybe more.
can CSSPD clarify your question, please? Host home and respite were not addressed. How should those settings be addressed? In regards to what?
We're going to CSSPD. We're going to unmute you to ask your question. So you're unmuted. You can ask if you would like right now. Hi, we can't hear you. You're not coming in clearly. In regards to quarantine, just to clarify that question, it was host home and respite were not addressed in regards to quarantine. How should those settings be addressed?
I guess it's not I guess in part, it's not clear in that if it's a host home, the host home provider is already sort of quarantined in the home with the person. That we're not paying more for host home in that circumstance.
There was a follow-up question. Just right. So there's a follow-up question for you, Don, where it says if you're adjusting the claim, the prior authorization is already on it.
You're correct. Are you able to remove the prior? I don't know if you're able to remove the prior authorization as a part of the adjustment. If you can't, I'll have to follow up with Conduent on that one.
Okay, when billing for the adjustment, what exactly are we billing? The entire rate or the difference, since we are not voiding the claim?
The entire rate, because the adjusted claim replaces the original claim. So your original, let's say the original rate was $100 and the enhanced rate is $115. You'd need to change the amount billed from 100 to 115. You would add the modifier to the service, and then you would also update the billed amount. And like I said earlier, if you can remove the prior authorization that was on the originally submitted claim.
Somebody follows up and says that they don't think you can remove the PA number on the original claims, Don.
Then if you can't, then I need to follow up with Conduent.
Thank you.
And actually, wait, I take that back. The PA being on the claim will not be an issue going forward because there isn't a prior authorization required for the modifier combination with CR. You got that message if you submitted claims on Friday or on Monday, because the decision to waive the prior authorization requirement was made today. Because you may recall that in the original transmittal, we were requiring a prior authorization for these services, but we have since changed that requirement.
Don, another question came in. Code T2033 U8 is lower than the amount currently billed, which amount do we bill?
I'm sorry, read that question again?
Sure. Procedure code T2033, U8, modifier U8 is lower than the amount currently billed. Which amount do we bill?
I don't understand the question.
I don't believe that's accurate. I'm looking at the existing rate prior to this modification, and I'm looking at the transmittal that went out, and I see a significant difference, an increase in the rate from, I believe it is $370.98 up to $524.03 per day. So I'm not sure from where the person, like, if you're aware of a different daily rate prior to this, please let me know.
Call me.
So I think that's what we have.
Is anybody there? Oh, okay.
We're here. Okay. Under the medically quarantined section of Winslow's transmittal, for providers who intend to implement either home-specific or provider-wide quarantine measures as a mitigation measure, prior notification of intended measures must be submitted in writing to their assigned QRS. Some providers have quarantined their homes to mitigate the risk of spreading the virus, as we saw COVID numbers increasing when staff were going in and out of the homes. Are these homes able to bill at the quarantine rate?
Yes, we're talking about exposures and we're talking about positive diagnosis. So to the extent that you have specific concerns, we track all of these and we have that information. You can call me and we can walk you through that.
What we need to make sure of here at DDS is that we have documentation that supports the basis for paying the enhanced rate for quarantine for that home at that time. And so, you know, I had said when we had one instance where this was done, we got a very thorough explanation of what was being done and the basis for it, and that provides us the sound support for then any future audit that questions why we paid this significantly enhanced rate.
And from that provider, I believe your quality person did send at least one documentation for the use of the quarantine.
If a provider does billings weekly and they pay twice per month, so this week they would be billing at daily rates for last week, they do not have all final approved timesheets until 2 weeks after the pay period ends, which for the first week of the month would mean that they wouldn't have approved timesheets to submit in advance of billing until a month later. This is going to pose a significant cash flow issue. Are they supposed to continue to bill at a regular rate, then keep voiding them after they are approved?
So to be clear, for the, first of all, for the enhanced rate, that's an enhanced rate for all current services, which includes the increase that should allow for overtime. I see there's a note from Ian questioning the decision to include that as enhancing the overtime as opposed to increasing the DSP wage. We at no time in the appendix case said we were increasing, just generally increasing DSP wages. What I have said is that we are effectively increasing the rate such that the providers can increase DSP wages across the board if they choose to use the increase in the daily rate for that purpose. If we were to have increased the DSP wage in the current model, it would have then been subject to all the modifiers that would have also increased the administrative rate that then goes to the provider, as opposed to just increasing the amount that's necessary to increase DSP wages, which has been done. Now, to be clear, for the regular, you just submit regularly your invoices. If we're talking about a quarantine home and you run into overtime, you're going to be billing straight for all the quarantine time, and the only thing you're going to have to submit to DDS is related to the additional funds necessary to pay the individual employee overtime. So that would be the only piece of this where there is that 2-week delay that you're referring to. I'm sorry, it was pointed out to me. Submitting to DHCF is submitting a claim, not an invoice.
Are providers able to submit for additional overtime reimbursement above the current enhanced rates for both non-positive and positive COVID-19 homes?
So I think the question is being asked to clarify for those who may not understand that all residential settings have been enhanced as a result of this public health emergency. And I'll repeat that. All residential settings under the waiver have been increased. It has nothing to do with overtime specifically, but that all those rates have been increased. When you start getting into quarantine overtime, individual staff in a quarantine home, by the way, that rate has also been increased significantly. But for overtime within those homes, because people are likely staying almost around the clock, the staff that reach overtime, that must be invoiced to us and approved by us and forwarded to DHCF. So you still bill the enhanced rate, you bill the quarantine rate, and in a quarantine overtime setting, you then invoice the overtime rate for those specific staff people.
Thank you for that, and we will look at the existing rate, because what I'm looking at and what you're looking at look different, but thanks for submitting that information, and we will look at that to see if an adjustment needs to be made. That's an easy adjustment because it has nothing to do with the Appendix K. But we will look at that particular rate and make sure that what we include in our transmittal is accurate.
And that was referenced in the T2033 question.
We got it.
I would appreciate Andy repeating the statement. I am still trying to understand if we can bill today, this week, for the modifiers before submitting the documentation.
So, okay, on the one hand, you have what's called the enhanced modified, what is it? It's called the modified rate? Or no, it's the enhanced model rate.
Right.
And those rates date back to March 11th, and everything that you did that's not quarantine, you can submit those as an adjustment with the proper modifier, including the CR. Separate from that, if there are quarantine, if it's the straight quarantine, then you can submit those. If it's quarantine overtime, you would need to submit those to us, so that you would need to submit that part of it. Just the cost of the overtime, which means, for example, if you had one DSP that worked 20 hours of overtime in a week, then you would submit $13.67 per hour times 20 hours, just for the cost of paying the addition for the overtime. The rest of what was paid to them is already included in the rate. Are you confusing, or does that predate my statement just now?
Yeah.
So if you could type in, it's not confusing anymore, if that's accurate.
When you say to send the invoice to DDS, do you mean through the e-invoicing or direct to you? If through the e-invoicing, would a PO be there to decrement against?
So, very good question. You're sending it to a CA because you already have an established relationship to the CA, who are going to then send it to the team who's going to approve it. I will sign it, send it to DHS. And just be clear, I don't want people to be confused. The enhanced rate is for everyone who provides residential services. There is no submission beyond you submitting your claim. The quarantine rate, you are to submit your claim and tease out those individual staff who've worked overtime, multiplied by the $13.67. That is to come to DDS, who's then going to certify, or once you present that that's a certified request to us in the form of an invoice, we're then going to forward it to DHS, who's then going to pay that additional money that was used to pay that overtime. There's a question that talks about we already have this staffing ratio, and that's true. I'm sending a report to request all staffing ratios. However, if you've ever had to do anything manually, if it's going to someone's hand to verify and the number is not there, they're going to have to look it forward or bump against it. I just thought that that would sort of expedite the process if it were already included. But we can have people look for the staffing ratio and bump it up against the submission without the ratio. We're not going to deny either one that's not there, because you're right, we have that information. So we will definitely take both of those. All.
Are there any other questions? If there is no OT and a provider still makes corrections to already submitted billings?
That's correct. So beginning March 11th, for all residential services, there is a different rate. So you would go in and make adjustments to all of those. The other is, it appeared to me that we had about at least somewhere around 265 people who were potentially eligible for this, who were in homes that would be eligible for the staff to get a quarantine rate. And so if you're looking at those where staff were working directly with people who were either self-quarantining because they had had a contact or had been diagnosed with COVID-19, in those circumstances, that could be billed. And as we've said, we really need to have the documentation of that. I think we have a lot of it already anyway, but so those could be billed as well.
So with regard to the Appendix K permits adjusted ratios, so to the extent that you're unable to meet a ratio, I would just ask that you inform us immediately, because at the point that we know that, we can look out for that and make the adjustments. The expectation, and I haven't heard when we talk about adjusted ratios, we were thinking down the road, if this thing got really bad and worse than it is now, what the ratios would be needed to adjust for homes. If you typically would have 3 people in a home and for some reason there was no way to make that happen, but to the extent that you're having that challenge, I'd like to know about it so that no one will question if in fact those ratios were not met. And
the only reason for the request for it is if we're paying overtime, it was to meet the ratio.
Right.
So if you called and said, we think we can do it with less than the ratio, and it could even be part of a plan to reduce the contacts that people have, then that could certainly be considered as part of like a, you know, one of these, the specific quarantine plans that people have.
Okay, we have a few more minutes. Are there any additional questions?
So just, I see, I'm looking here, it says, asking this one for clarity, which I thought I had asked people, was it clear before, but it's possible that it isn't. Please provide clarity as to how DDS intends to operationalize the ongoing submission and approval of DSP overtime reimbursement rates. Just to be clear, we modified the rate paid retroactive to March 11th, enhanced the overtime factor to increase the rate to account for increased costs related to overtime, or as I said, increased direct pay, regular time to all DSPs if you chose to use the effective approximately 15% increase for that purpose. And so the submission for those claims is just done consistent with these new rates. It's not a matter of when you reach overtime. In those instances, you're just billing straight what this new rate is, which includes an enhanced overtime factor.
I just want to confirm that a PA number is not needed for claims with the additional CR modifier. Is that correct?
That is 100% correct. It was set up to require authorization or PA number. When we initially set the codes up, that adjustment was made today or is in the process of being changed by Conduent. I have not received the final email saying that they have made the changes that I requested this morning. And just for the record, if you do put a prior authorization on your claim, it will be fine. The system will bypass the PA requirement because the service does not require prior authorization.
Is there a contingency plan in place to reopen day programs after May 15th, the day that PA expires, for in-home support and ACS COVID-19 date?
So there's a few things. One is, okay, first of all, May 15th currently is the date in the mayor's order for the stay-at-home order to expire. And we'll learn more about that as we get closer to May 15th. People may be aware that there is a process in place currently of a reopen DC plan that is being developed by the mayor and a number of stakeholders in the community. And being on one of those committees, I can tell you we're working long hours to put that plan together, which is due to the mayor by May 11th. That plan addresses the process for reopening, but it doesn't address the timing. The timing will be addressed by the mayor in consultation with DC Health based on the medical facts on the ground. Keep in mind, the one issue to be aware of for retainer payments for day programs is the number of days. So the retainer payment can only be a claim of up to 18 consecutive days. And consecutive means Friday to Monday are consecutive days based on CMS's counting. When we discussed this with them prior to the approval, they said for daily services that are provided Monday to Friday, Friday to Monday counts as consecutive. So we can't approve retainer payments for more than 18 consecutive days. But there can then be a break of a day and then another 18 days. And so authorizations for services beyond that May 15th date for other alternative services, we need to make sure are in place so that those services can continue. We're going to have to talk about how we move toward reopening day services. There's a whole range of day services. And, you know, at this point, we are still very much, there's the Reopen DC is relying on some guidance that's been provided by Johns Hopkins University School of Public Health, and it looks at sort of staging the reopening based on the facts. DC is still in stage 1. We have to have 2 weeks of declining cases. There's a number of factors in place before we move to stage 2, which is a phased reopening. People who are at highest risk of contracting COVID-19 are going to be the slowest to phase into this reopening. And so, you know, so we will talk as we move forward about what those phased reopening of day services look like. But the retainer payments are available throughout the pendency of this Appendix K. The only condition being it's 18 days on, 1 day off, 18 on, 1 day off. And you can have as many 18-day periods as you have throughout the year of the current Appendix K. Let's hope it doesn't go that long.
All right. We've had several annual ISPs in which the agreed upon day services were not included in the plan of care despite all day program documentation being submitted per DDS policy. This is usually the case when the plan of care now includes companion services 5 days per week in lieu of the day program during the current public health emergency. However, if day program service hours are not included in the current rate authorizations, the day program cannot bill for retainer payments. Should we be asking DDS service coordinators to amend the ISP so that the day program can bill retainer payments?
What I would ask you to do is to send me an email of all of those cases. We had explained to service coordinators not to discontinue day habilitation services after getting authorizations for companion for the time people usually would be in the day services, because we didn't know when this was going to end, and we didn't want to have to go back and modify all of those ISPs to include that fact. And what I'm reading from your question, it sounds as though people did not use the logic behind that, and if they did not include it and it was authorized prior to the ISP, now they're not including it in an ISP. I want to know about those cases, and I'll work on them as quickly as possible to get them amended so that that service is reinstated.
All service coordinators are not following what you're saying.
Could I just ask a clarifying question? That could be read 2 different ways. One, it could mean 100% of service coordinators are not doing it, or it could mean 100% are doing it the wrong way. So did you mean that there's not 100% compliance, or that there is 100% failure to comply? I said 2 choices, you got to pick one. Okay, thank you. Now we go ahead.
Again, as many of you who have many people working for you who you train, explain, and guide, there is the off chance that there are a few who misinterpreted and did not seek clarification. And that's why I keep saying that I want to know about these cases, because I need to know where my team members who don't get where I think they should be are. And then secondary to that, I've heard or seen it written that one-offs are not sort of sufficient means. I had a conversation with one provider in 5 minutes, understood what the need is, and it has since fueled a major change in how we're going to allow a service to be provided based on a conversation. So call me, please.
Okay, so it seems that we have a request again for clarification. To be very clear, for the, regarding the current rates for all residential services. So what the Appendix K has done is that it has modified the rates for all residential services that were contained on the attachment to the transmittal that went out last week, so that retroactive to March 11th, outside of times that you would submit claims for a quarantine period, which would be further enhanced, but for regular billing for all residential services, the daily rate is enhanced. So you should submit adjustments for all of those that you may have submitted prior to this, because effective March 11th, there is the enhanced rate for everyone.
Hey, Andy, I have to drop off for a previously scheduled call with Conduent. Are there any more questions related to billing before I do so?
And we all actually have to drop off. It looks to me like we've covered all the questions, so thank you very much, Don.
All right, thanks, guys. Continue to be safe.
I also have another conference call that I pushed off to 1:15 in case we ran a little bit over. I'm hoping this provided some more clarity. You know, I appreciate that this process has taken longer than all of us would have liked, but I hope that at this point there is more clarity about it. And just once again, I just want to communicate my appreciation to you and all your staff for all the work that you're doing. We are here doing our best to try and support you in this, and trying to address the concerns that you have, and really trying to keep up with the events on the ground so that we can help you to respond currently, and really, you know, do all of us together do our best to protect the people that we all support, as well as your staff who are on the ground working with them. So thank you very much.
Thank you.